Welcome to your local news station, WGHA. I'm Tiffany Kane.
And I'm Nancy Kevorkian, no relation.
And this is our special edition of Field Notes Live, where we hit the noisy streets of Seattle to bring you the inside scoop on global health innovation.
Speaking of innovation, what do we have here?
We have one of our latest inventions. It's a handheld scanner that detects substandard medicines using near-infrared light.
Wow, I didn't know that was even a concern. Are you sure that isn't fake news about fake drugs?
Actually, no. Drugs that don't do what they're supposed to do, or as we would say are falsified, are on the rise. A current estimate is 18 to 19% of drugs in Africa.
And this device will weed them out and save lives. Now let's check in with Tiffany.
Thanks, Nancy. Do y'all have a drink in this cooler over here?
Sorry, no drinks in here. This cooler is actually for vaccines.
Wow. In that case, can you tell me how it works? I'm actually here reporting on global health innovation.
Oh, sure. This doesn't just store vaccines, it actually prevents them from freezing, which helps keep them viable so that they're most effective for the kids that need them.
That's some pretty hot tech for the cold chain. Now back to you in the studio, Richard.
We're getting video footage now showing another way vaccines are delivered when roads are not an option. Village Reach is supporting the government of DRC to transport vaccines, lab samples, and other health products. It used to take 6 hours to reach the village you see here, but this drone safely transported vaccines in just 20 minutes.
But now, on to everybody's favorite dinner topic, poop.
Well, everybody poops, don't they? And in some parts of the world, we need new and innovative solutions to get rid of all that waste. And one of the cool things that we're learning about is the tiger toilet. And instead of water or a sewer system, it uses tiger worms to get rid of the waste. It's pretty cool, huh?
And that's the scoop on poop.
Wow, Eric, it is so hot out here today.
No joke. Temperatures are soaring all over the globe.
Actually, Eric, that is so true. Did you know in Kenya, nomadic farmers are taking their camels further out to find water due to the frequent drought? Drinking camel's milk when not heated is very dangerous. WSU is learning how bacteria spreads and how people can safely drink it. Because when it's safe, it's good and healthy too.
That is really tasty stuff.
Back to you, Tiffany.
Thanks, Eric. I just came over to investigate this biohazard box.
We just got more tests in from Honduras. We got to get these to Jerry at Fred Hutch so we can get our CML patients tested.
Whoa, Jerry? Can you tell me what's in the bag here?
Absolutely. This is how we cure a disease called chronic myeloid leukemia in the developing world.
Wow.
You have to do special tests on these patients to diagnose them.
Okay.
Usually you would have to send blood by special mail, hundreds of dollars per sample.
Too much.
Figured out a way to basically put spots of blood on this card, which you can keep for like months before you actually do the test. So you can batch them, send them by mail.
Yeah.
Pennies on the dollar.
Yeah, and then we connect all of our patients to life-saving drugs that they get free of charge that are donated for the rest of their lives.
Time's wasted. Gotta get going. Thanks guys.
Jerry.
I think we have some breaking news from Australia, but it's hard to make out. HDR, can you give us a hand with this? HDR translates complex data into useful visuals to help clients make decisions. That's what they did in this visualization for the Global Health Alliance Australia. Back to you in the field, Tiffany.
Little early there, Richard. I'm still in my reading break here. What are you reading?
Actually, I'm reading about one of our global health studies that was featured in the New York Times.
Wow, that must have been an important study. What did you find?
So the study confirmed that women around the world have one less thing to worry about. It ended speculation on Depo-Provera and found that it does not substantially increase the risk of getting HIV.
Injectable birth controls are really commonly used. I bet that's big news in Africa and around the world. Can I read more?
Oh, I am so sorry. I'm just looking at these photos from my son on WhatsApp. He's traveling the globe.
No problem, I get it. We just launched a project using WhatsApp in the Dominican Republic. Teen moms there really need support and information. We found that using WhatsApp helps us share resources and connect them with other young moms.
And speaking of new moms, we're getting an update from the zoo on baby Eki.
Baby Eki's birth at the Woodland Park Zoo is an example of these conservation programs at work. Our local zoo leads the tree kangaroo conservation program in Papua New Guinea to protect these endangered joeys.
Thanks for picking up salads.
Oh yeah, for sure. You know, ever since we published that study saying that poor diet kills more people than high blood pressure and tobacco, I've been all about those salads.
Yeah, that was big news.
Yeah.
And did you all know that livestock farming is the biggest contributor to climate change these days? Yeah, that's why we started the planetary health diet.
Hey guys, anybody got a burger?
Nancy, wrong crowd.
Impossible Burger?
And now for the final scoop on our Field Notes Live special edition. Whoa! Dina?
I don't know what that was about, but what I do know is that the biggest news of the year is you. The work that you do every day to save and improve lives around the world is the real news. Thank you. Thank you for the work you do. Thank you for making Washington's global health ecosystem into a real community. And thank you for supporting your local television station, WGHA.
To bring you the inside scoop on global health innovation. Speaking of.
Everybody gets a salad!
Beautiful, beautiful.
Hey guys, doesn't anyone have a salad?
Oh my God. Thank you? Thank you.
Actually, Richard, shoot, I call him Richard. Okay.
I mean, am I waiting for something to happen back there?
Guess not.